Joining me now is Professor Laurence Walsh from the University of Queensland, who's been giving a session on the challenges in temporary infection control. Laurie, thank you for joining us.
It's a pleasure, thank you.
Could you just give us a little bit of background about traditionally how is infection control approached?
Yeah, so traditionally in the 1980s there was a very big focus on bloodborne viral infections because this was the time of the emergence of HIV and when hepatitis C started to reach large proportions. So the big focus was on bloodborne viral infections and what were then called universal or standard precautions. Today we understand the situation is actually a bit more complex than that, and we need to be focusing on basic things like hand hygiene and also controlling aerosols in a dental practice, rather than just thinking about what happens once in a blue moon, which is a skin penetrating injury. So the emphasis is now on what you'd call the occupational health side of infection control.
Are there more risks in those sorts of infections then?
Yeah, exactly. So when we've looked at it, 95% of dental staff suffer irritant dermatitis of their skin through the use of detergents. So it's a big occupational health issue. When you move to alcohol-based hand gel, that shrinks that problem down. When we've looked at the quality of air that dentists breathe and dental staff breathe, it's actually reasonably poor because of the production of aerosols. So we're trying to focus on things that address these occupational health problems so people can go to work and come home without taking home the flu, for example, or some other respiratory infection from work.
So how is the dental profession doing at tackling infection? Yeah,
generally speaking, most people are doing a pretty good job. The issue has always been around getting complete compliance for every patient every time. So the areas that we see problems in are people who are, for example, not wearing their mask properly, not adapting it well, skipping on some of the steps of hand hygiene between patients, just cutting little corners either because of lack of knowledge or just trying to save a little bit of money or a little bit of time. So there is still a need to reinforce what are the platform basics that apply for every patient every time.
And how do you encourage the dental profession?
Yeah, probably the best way is by making sure that the dental assistants and the dentists know exactly what they should and shouldn't do. So one of the things we talked about in the lecture was examples of good practice and examples of bad practice. And I showed them a little graphic that we produced in my clinic which shows here are all the wrong ways to wear a mask and here are all the right ways. When you've got these simple visual tools, it keeps everyone honest and keeps everyone compliant with what the party line should be. So simple graphical messages tend to work very well in infection control.
Because infection control is really crucial.
Absolutely. In a dental practice, we can easily spread things that are based on aerosols. We come in contact with saliva and blood, and members of the public expect us to be practicing at a very high level. No one expects to go to the dentist and come back with an infection they didn't have before. And patients are very aware of what the risks are from going to hospital and coming home with an infection. So they know what should be done. So we're trying to make sure that we are aligning our standards and making sure that people can be confident that we can treat them well and also safely.
What are the main infections that we're talking about here that are people at risk from?
I guess we'd focus on three that all relate to the inhalation of material, so quality of the air. The first one would be human influenza virus infection, the second one Legionella, and the third one would be tuberculosis. What joins all those three things together is that when we produce air from a patient's mouth, when we produce aerosols, that produces an area that we can breathe in, but also later patients in the day who come into the surgery also get to breathe some of that air in.
If you could have everybody that was at your session and everyone that's watching go away with one message, a brief message, what would it be?
The message would be consistency, to make sure that you treat every patient to the same standard, regardless of whether they're a member of your family, they're someone you've never met before, doesn't matter what they look like or their background, you treat everyone consistently well, not assuming that they're infectious and not assuming that they're not. We always work on the basis that everyone's a potential source of material. So consistency, every patient, every appointment would be the message.
Professor Laurence Walsh, thank you so much.
It's been a pleasure. Thank you.